Welcome to Primary Care Today. I'm your host, Dr. Brian McDonough, and my guest today is Dr. Nancy Phan. We'll be joining Nancy in a moment, but I want to talk a little bit about today's subject and how it evolved. It's about baby-friendly. You may or may not have heard about it. I, frankly, did not hear about it when I was at a hospital governance meeting where we were talking about different health issues. It came up, and I thought it was a very interesting concept. It's about the idea of breastfeeding and encouraging mothers to breastfeed shortly after having their baby. They say becoming baby-friendly does mean adhering to certain guidelines, but it doesn't condemn mothers who choose for whatever reason not to breastfeed. The goal of the initiative is to help mothers make an informed feeding decision based on what's healthiest for them, their baby, and family. The removal of free formula samples refers to banning the practice of giving new mothers a diaper bag gift, which is provided to a maternity hospital for free by a formula company. Research has shown that when a mother is given one of these bags, even if the formula in the bag is removed, the mother will go on to exclusively breastfeed for a shorter period of time. And that's where I'll stop, and I'll introduce Dr. Nancy Phan. Dr. Nancy Phan is an obstetrician gynecologist. She is also the president of the Medical Society of Delaware. She knows about what she speaks, and she's very good about talking about it, and she clearly has a balanced view on this issue. So I think both you and I, Nancy, would agree breastfeeding has intrinsic value, and just about any physician out there is going to say there's a great reason to breastfeed. And I would have to think, as I welcome you to the program, you agree with what the organization says about all of the benefits of breastfeeding.
Yes, absolutely. I think that's one of the primary reasons why this initiative actually began with the Breast Baby Friendly USA, and actually probably what drove the World Health Organization in the first place to put into the 10 steps that they recommend to successfully, exclusively breastfeed.
I wanted to set it up how this is something that's I wouldn't call it volatile. I think we all agree on the importance of breastfeeding, but it's one of those things where if you put something out there, there were all of a sudden all sorts of tweets, Twitter responses, discussion. This will probably lead to more discussion. It's certainly an issue where it's getting a lot of people thinking. And do you think that's one of the goals of this entire baby-friendly initiative?
Yes, I do. I think they are trying to sort of do a cultural re-education about the benefits of breastfeeding and having people realize from every single step of when a woman becomes pregnant to after they're having the baby to when women go back to work or when they're in a public place, that breastfeeding is a natural, acceptable condition, and that we're trying to promote it so that not only for all the benefits that baby-friendly spouses for moms and babies, but also that culturally people can be comfortable with it and realize it's okay. But for both the mom, that it's okay, and that they're doing what they think they are trying their best, and that, you know, in society, that when a breastfeeding mom is seen, that they're not uncomfortable breastfeeding.
So when we look at that side, we also look at the other argument. I go back to the point this organization said where they talked about not giving the formula in a diaper bag. Where I had concern was it's almost like they're stacking the deck. Again, I'm in favor of breastfeeding, but I also believe that a mother at this very important time of her life doesn't need to feel guilty or concerned or in any way really be coerced. I mean, I am all in favor. If something's going to stop people from cigarette smoking because it will kill them and it's guaranteed to kill them, do all you can, humiliate them, shame them, get them to stop. I really am a big fan of anything when we know there's a definite thing. I would say the same thing about heroin, a lot of things like that, texting while driving. But I look at breastfeeding and go, there's a lot of advantages, but a lot of people weren't breastfed, and they certainly live healthy lives, and they do quite well. And when I see that they're removing formula, which is free and a service to some who may really need it, and they're removing it because they think it will reduce the amount of time that someone breastfeeds so they don't make a 6-month goal or a 4-month goal, I say, you're stacking the deck. Is this really what we want to do? And as a devil's advocate, what do you think when people ask that question?
Well, I kind of turn the question around to them. Don't you think giving them free formula is stacking the deck against them exclusively breastfeeding? So it's that subliminal commercial message. When you give someone a free item, they will use it. And when you start using something like that, it does take away the breastfeeding opportunity and exclusively breastfeeding. I do agree that a happy mom is a good mom, and I say that to my patients all the time, and in no way do I think that the point of taking away formula or promoting exclusive breastfeeding is to make people feel guilty or to make them feel bad that they're not doing, quote-unquote, what they think is best for their baby. I do think that the education begins long before they get into that postpartum room where they're given a free diaper bag. The education should begin even when they first find out they're pregnant and they're in the physician's office and they're given information about, what it is to be pregnant and what you need to expect afterwards. And as they go through the pregnancy, we talk about actually the evolution of your breast development during your pregnancy and as your breast gets ready, quote unquote, to lactate. These should all be part of the conversation so that when they come in and they are trying to breastfeed, that they feel comfortable and encouraged to breastfeed. The free diaper bag, I agree with Baby Friendly, is not really the issue. The issue is that, when they get the free formula or they get the logo on the diaper bag, it's that subliminal message. And I think really what it's saying is that it's not saying that we want to make it harder for you to get this stuff if you need it, because frankly, Baby Friendly says, if your patients ask for it, give it to them. They're not saying, don't give it to them if they ask for it. What they're trying to say is that people associate that when they see that diaper bag, oh, this hospital says it's okay to formula feed. And we're not saying it's not okay to formula feed. We're just saying we prefer that you do the breastfeeding. You try the breastfeeding.
If you're just tuning in, you're listening to Primary Care Today on ReachMD. I'm Dr. Brian McDonough, your host. I'm speaking with Dr. Nancy Fan, who is also the Medical Society of Delaware president. She speaks about a lot of issues in healthcare, but today we're talking about Baby Friendly, and she certainly is well-versed to talk about it because she's an obstetrician gynecologist, delivers babies all the time, and is on the nursery, sees things, and clearly sees the pros and cons of all the things we're talking about. Taking this one question just a little bit further, one of the ways it's done, and I'm not sure if every hospital is going to this point, but they're actually resorting to saying doctors need to order a formula as if it was a medication and even keep it in a Pyxis system, which also sends a message that formula is just so non-natural. It might as well be an antibiotic or a hormone replacement type of therapy or whatever.
So, I know, one of the standard neonatal protocols, obviously, is giving them vitamin K and erythromycin ointment, and that's kept in the Pyxis, and that actually requires an order also.
But they're medications that are, and they're also regulated by the FDA as medications,
yes,
right?
They are medications, and yes, formula is not an actual medication, but what some hospitals have come to look at it as, some hospitals that are baby-friendly, is that it's a supplemental artificial product. And so if that's what that hospital has decided to do, from just reading what other hospitals, why they've actually decided to do that, I actually went back and tried to look at what some of the rationale was. One of them actually was so to make sure the formula was actually coming from the pharmacy that it was actually being accounted for. And it wasn't just coming off a shelf and, randomly handed to a mother and not knowing exactly how much formula the baby was getting, which can happen. That's actually been shown in studies that if the formula is just sitting in a drawer accessible to mom or mom's family, that they are randomly taken and given to the baby, and the staff isn't always aware that the mom is not solely breastfeeding, which is fine. But I think what we want to know, if we need to educate the patients, we want to say, was there a reason why you felt the need to give the baby formula in a non-judgmental fashion? We wouldn't know that unless someone was kind of try to keep track of it.
When we talk about this, again, I want to stress to the audience and the docs and everybody listening that, certainly breastfeeding is a preferable option, and we all agree about that. But this is a discussion where we're talking about really the techniques and the tools to try to have people go in that direction. I think so. The question really is this the right thing to do, whether you say it's ethical or a medical judgment or whatever? Is it right the way we're trying to encourage people to do it in the hospitals that are baby-friendly? Even to the term baby-friendly, as if they're taking formula, it may not be baby-friendly. I'm surprised they don't call it like breastfeeding-friendly or something. It just seems like it's taking that extra step, like a presumed positive effect no matter what, whereas you could use the argument baby unfriendly if you don't.
Certainly, I don't think that was the message that they were trying to convey. I don't think any hospital wants to try to convey that. And as you said before, you don't want the mom to, quote unquote, feel guilty and make them feel like they're making a poor choice for their baby if they decide to formula feed. I think, once again, some of the patient population we're trying to address, when I spoke to you earlier, they have a 20 to 40% breastfeeding rate. That's leaving the hospital. And knowing the benefits of breastfeeding and bringing that up to 60% rate seems like a reasonable goal and something that should be tried. Now, not everybody's going to succeed. Not every single pathway is going to be the most successful. Baby Friendly does encourage, and when you get advice from other Baby Friendly hospitals, they do encourage that you want to be supportive and you want to be able to show them in an open-ended way, try to have them rethink exactly why they're making the choices they are. Moms get tired. Moms are sleepy. It's exhausting. And it's exhausting to breastfeed, especially when you're only producing the colostrum and you're not producing any of the regular milk that comes in. And it takes work. It takes a lot of work. And we all recognize that. And the goal is that the staff is supportive and trying to encourage the mom and be there for them and provide them resources that they might not be aware of so that they can actually either continue. I've had moms come in because they are so distraught that they weren't able to breastfeed even up to the 2 weeks that they come in to see me, and I call them and I'm like, why didn't you call me? Why didn't you ask me if I could send you to a lactation consultant, provide you a resource? And I think that's one of the more beneficial ways to go about doing that. I think when you're talking about the nitty and gritty about what to do with the formula and how do you make sure that it's being tracked and how do you make sure that, moms aren't trying to, just quote unquote use it without realizing that they might not be helping their babies become exclusively breastfeeding. Those are, I think, difficult questions. It seems to me that a lot of hospitals, when they come up to those questions, it's a challenge. It's a challenge for the staff. It's a challenge for the physicians, and trying to pick the best way to do it without making your patient, like you said, feel bad, is I think the goal.
I appreciate all the points you're making. I want to mention, too, that the Baby Friendly USA website, babyfriendly.org, is a site you might want to go for more information. No less than Surgeon General Regina Benjamin talks about how healthcare systems should ensure that maternity care practices provide education and counseling on breastfeeding, and they should become more baby-friendly by taking steps, as she says, like those recommended by the UNICEF, WHO's Baby Friendly Hospital Initiative. I want to ask you one last question before we go. Tell me what you think are maybe the top 3 reasons why a woman should breastfeed and the advantages for her and the baby.
The top 3 reasons, I definitely feel there's the bonding, there's the health issues. The health issues, if you want to say separately, is issues, one for mom and one for baby, because actually there's been shown to be decreased maternity, obesity rate, as well as, I'm sure you know, breast cancer for women who actually solely breastfeed. Those would be my 3 top reasons. Breastfeeding's not for everybody. I think everybody recognizes that, and I tell my patients, it's not quite as natural as everybody likes to think it is. But I think it's then our job and our challenge to help those who want to do it, that they are able to succeed in their goals.
Dr. Nancy Phan, I want to thank you very, very much for taking the time to join us. I think you brought to light some really good points and advantages of going in that direction. I want to thank you for taking the time.
Thank you, Brian.
This is Dr. Brian McDonough. If you missed any of this discussion, please visit reachmd.com/primary care today to download the podcast and learn more on the series. Thanks again for listening.